Okay, so we're going to get started, even though there's not too many of us here just yet, but we know that obviously folks are going to join us on catch up, which is great. So we might get more colleagues joining through the session. Sorry, I'm getting some. Can you hear some terrible electrical noise? Okay, so it's just my end. That's absolutely fine. My computer's just started making a terrible noise at the worst possible moment. Which isn't a great start to the session, but here we are. Okay, hello everyone. So this is the third of 3 sessions that we've been running on the health T level. So I'm Dr. Rebecca Conway, NCFE's Director of Research and Innovation. It's really great to have you with us today. We've got some fantastic speakers on the session today. So NCFE doesn't have any role on the T-level placement. So I've brought a cast of brilliant experts who have insights for you onto the ways to run a really effective placement. So in terms of the session today, I'm really delighted to have contributions from New College Swindon. We've got 2 Karens with us today, Karen Beecroft from New College Swindon and Karen Kelly from SDN. We've also got Lucy Hunt from NHS England. We've got Claire Reynolds from Gatsby, and we've got Kerry-Ann Pilato from ETF as well. So I'm going to run a tight ship timing wise and make sure that we all can get all those contributions in because there's lots to get through. Much like the sessions we've had over the last 2 weeks, we are recording, yes. Much like the sessions we've had over the last 2 weeks, we will be going through at quite a speedy pace because this is intended as a sort of quick reference guide, if you like, so you can watch the video back, you know, where to dip in and get support and guidance. We also send out the slide deck afterwards, which has got loads of useful links in it from colleagues who are with us today, and the video as well. So we'll send a YouTube link to everyone who's registered after the session. So to get things started, please do put any questions in the chat box or the Q&A as we're going along. But we'll start with Karen Kelly from SDN. So Karen, I'll be running the slides, so just let me know when you want to move those slides forward, unless you're able to do it and you want to do it, and that's absolutely fine.
No, happy for you to do it, Rebecca. That would be fantastic. Right, afternoon, everybody. So let's have the first slide then. So the programme I wanted to just give you a little bit of insight into today is the provider support programme and the element that SDN have been running. So our friends and colleagues in AOC also work on the provider support programme, and we've got a strand which is all about the employer engagement side of this. So working with colleagues in schools and colleges around kind of developing, I guess, that employer engagement strand. So I just wanted to share some of the resources and tools that we've been working on and the things that are available to you. So if Rebecca, you can move me on, that would be great. So this is our kind of slightly cheesy image that we use on our training program, but actually working with our employer engagement colleagues to help them understand that, you know, they are an essential part of this. T-levels cannot succeed without good employer engagement, without good sound industry placements. So we've got our 2 pillars there, left-hand side, local employers, right-hand side, our students. And obviously both of those parties have got very specific needs and they've got their own lens that they look through around industry placement. And the piece of work we're doing is kind of focusing on the middle bit around those employer engagement professionals. I kind of quite often describe it as they're offering a translation service. They're trying to kind of understand the needs of employers and broker that conversation. And they're also trying to understand the desires and the future aspirations of their students and do some of that kind of matching across, if you like. So often that's about challenging perceptions. It's about finding solutions, bringing things together. So, you know, an absolutely key bit of what makes T-levels work. So we have to help our employer engagement folk kind of, you know, be strong, be supported in the roles that they're doing. So we work quite a lot in our programs around probably around kind of how can they do better in terms of working with curriculum colleagues or working with their apprenticeship colleagues, as well as then thinking about, you know, representing professionally to employers. Thanks, Rebecca, you can move me on one. So there's 4 strands of the offer that we've been working on, and they are around resources that we've created to help employer engagement so that we haven't got bunches of people spending lots of time around the country starting on things from scratch. So we've created lots of kind of tools, resources, kits, mostly things that people can pick up and just edit and go with. So not blank pages, not blank boxes to fill in, but things that are useful. And I'll just kind of give you a glance at a few of those in a moment. We've been running a CPD program, which we're nearly through the end of now. So we've been running that since Easter time, and we're just finishing off our existing cohorts. We've created a LinkedIn forum for our employer engagement colleagues, so that they've got a professional network, a place to share success, to ask questions, to kind of bring some of that that professional oversight, I guess, across other people doing the kind of role that they're doing. And I've got links in these slides that you can see those. And then collaboration activity is the next strand of our activity under this DFE funded offer. So we've been going since September 2023, and this project at the moment runs through to next August. If you just click on the slide, Rebecca, I think you'll get a little finishing line flag come up just to show that we're pretty much at the end of this bit of CPD. But if you take me to the next slide, I can show what else is there. So what we've created in terms of our tools and resources, there are about kind of 80 to 90 resources that have been designed and developed for our employer engagement colleagues. And each of these blue boxes or tiles, if you like, this is just a screenshot of a PDF sort of navigation tool. So you don't have to lose yourself in gov.uk trying to find the document you want, which is always a bane of most of our lives, I think. But actually you can click on these tiles and go straight through to where the document is on gov.uk. So we've developed tools, and you'll see them in the swim lanes around preparation stages of how do we kind of get employer engagement established. What are our awareness raising tools for employers? If you click, Rebecca, I just wanted to point colleagues to one of the really popular tools, which is about how do we ask the right questions of our curriculum colleagues so that we can go out and talk really positively and knowledgeably with our employers around the whys and wherefores of the particular T level. And if you go to the next slide, that will show you a whole bunch more resources as well. So I'll pop the link, once I finish talking, I'll pop the link in the chat to this as well, but you can find this on the SDN website too. So taking then employers through kind of those that are showing an interest, how do we build that interest, how do we develop that engagement with employers through to decision. And then, you know, often I think at the end of industry placements, we all want to sort of lie down in a darkened room. And actually what we need to do is squeeze the goodness and the learning of kind of what worked well with employers and build on that so that we can be even more successful next time around, or even scale with those employers. So I think if you just click, Rebecca, what you'll also get is a couple more arrows that just point you specifically to some health resources that I wanted to point, because I know we're kind of being health focused today, but actually our programme is across all T levels. So just kind of giving you a pointer of some that you might want to take a look at. You can pop me onto the next slide. So our next, just back one, our next piece of work, it doesn't want to stay in place. There's a slide that you've got a little cheeky glimpse of, there you go, around collaborative practice. So this is our next piece of work that we are working with employers and groups to have a look at some of the really good examples of collaborative work that are going on across the T-level space. So we know that we've now got interest from multiple sited employers who need to work with more than one college or school, and actually how can we take some of the learning around what's working well and how have they set those things up and share that back with the wider population so that not everybody is starting from scratch. We're having a particular dive into perhaps certain T levels or occupational needs. So creative and design is one of the areas we're looking at, because we know there are some challenges in that space. Or again, if we're wanting to kind of build significant volume, we're working with the industry placement coordinators for the NHS to kind of try and take some of the good good work and good practice that's been going on there, and see how we extract some of that and create some resources and tools out of it that we can share back with the wider sector. So that's our next piece of work, and we expect to have some more resources and some tools for you around Easter time next year. So that work's going on at the moment. And then I think one last slide in terms of content from me. Just giving you guys a quick heads up and hold the date. So this week, as we're celebrating T-Levels Week, you will have seen announcements from DFE at the beginning of the week around some additional flexibilities. What we know is that DFE are currently rewriting the delivery guidance that will sit alongside that. So as we know, with all of these things, the devil's in the detail, and we need to see some of that detail. Whilst the flexibilities will run from January, actually there probably will be some nuances and some more detail that you guys will want to see. So we're going to do a session on the 28th of January. So pop the hold the date in, and Rebecca, I'll make sure that you've got the invite. Perhaps you wouldn't mind circulating to this group of people, or indeed if you sign up to our forum on LinkedIn, then you'll be the first to kind of hear about that too. So love to see some of you if you think that's relevant at that. And I think that's it for me. I think the next link is just a link. Oh, the other one, the one that we skipped through, was our LinkedIn forum, so you can join us there. And I'll pop the navigation tool in a second into the chat. But that's me, and hopefully to time.
Thanks, Karen. Yeah, perfectly to time. So thank you so much. That was really helpful. And yes, if you do share that link, I'd be really happy to circulate it. I thought we've not had any explicit questions in yet, but do send them in if anyone has any. But I thought it'd be useful, given the theme for today's session and all the speakers that we've got with us today, to just get your kind of one top tip really for effective placements. If you, from all your experience of working with providers and employers and all the support you've provided in this area on health and the other T-levels, what would your one top tip be?
I think one of the things that definitely feels like it's missing at provider level is strategy. So actually that conversation at the beginning with others that are involved in employer engagement, so that we go out to our employers in a really coherent professional way. So we've got leadership buy-in, we've got curriculum buy-in, we've got our apprenticeship team buy-in, and there's some thinking around how that fits in. I think we're still in a place where T-levels feel a little bit the poor relation in lots of education institutions, and we need to overcome that. We need to kind of, get with the programme and make sure that's happening. So I think we have got a strategy drafted so that people don't have to start with a blank piece of paper. So that is one of the tools if people are interested in that.
Fab, thank you, Karen. And that really flows nicely on, and we've done this on purpose, obviously, into Karen Beecroft and her presentation, which is from that provider perspective. So thank you, Karen Kay. I know you do have to run, so thank you so much for your contribution. Karen Beecroft is from New College Swindon, and Karen's going to give that provider perspective. There's a little bit of background noise.
Oh, is there?
Yeah. Is that from you, Karen?
I don't think so. It shouldn't be, because I'm in a...
Let me just have a little, I'll just check.
Let me just go and see.
That's stopped now, I think, so.
Has it stopped? Let me go over into a different corner. Bear with a second. Is that any better?
Perfect. Thank you, Karen.
That's all right.
It's good as well, live from the coalface.
Yeah.
It's a busy provider environment. So we really appreciate your time, especially during T-level week, as I've said already. I know there's lots of engagements on top of, the work of delivering every day as well. So Karen is the T-level health program lead and assistant curriculum manager for health and social care at New College Swindon. And he's going to speak to us about the provider perspective on what makes a really good placement. So, Karen, I'm going to do the slides. So just next slide, please, please.
Yeah, I will do.
Traditional post-COVID style.
Yeah, I will do. Thanks, Rebecca. So I will just give you a little bit of an introduction. So if you go on to the next slide for me, please, Rebecca. So we are a Wave 2 provider. So we started delivering in 2021. Our cohorts have increased by lots of numbers. If you press all the buttons and all the bits should come up. So when we initially started in 2021, we had a cohort of 30. We deliver 3 of the 5 pathways at the moment. So we're delivering supporting the adult nursing, supporting midwifery and mental health. We are also looking to add support in the therapies due to our local need. And I'll come back onto that, to why we're looking at that one. Each year our numbers have increased. So currently enrolled on our T levels at the moment, we have 32 in our year 2 cohort and 60 in our year 1 cohort. So we currently have 92 students on T level health within our college. So if you go next slide for me, please, Rebecca. So this is just an example of some of our facilities and some of our students. There's a picture of half of our students that are our current year 2s that are on placement in our local hospital at the top there, with all their uniforms and things on. I've just included some pictures of some of our facilities for you, so you can see some of the areas where we do some of our teaching in, because that's one of our unique selling points, especially with our employers. So if we go on to the next slide again for me, please, Rebecca. So what we do around our current placement and how we set it up to make things kind of work a little bit for us, we have all DBS checks have to be completed within 42 days of the start of the course. We give out the details of application for DBSs at enrolment so that we can get that ahead of the game and get started, so we can get our students out on placement as soon as we can. All of our year 2 students, we've got 25 of the 32 are in our local hospital, 6 of them are in the maternity setting. And for our year 1 students, 40 of the 60 have been secured a placement in our local hospital. And what we do as part of the interview process for our local hospital is the staff come into the college. They go through what they're expecting of them in a little session with them. They come back and they actually interview the staff, the students, along with us. One member of our team would sit on the panel with them. The hospital staff come and do the interviews, and then they decide who they want for the students to go in. But some of the other things that we do around employer engagement is, if I get you to go on to the next slide for me, please, Rebecca. So these are some of the things that we do to help with our delivering the placements and getting employer engagement. So we held an open event for employers to come in and see our facilities. And part of that was we have students in there demonstrating some of the skills that they're learning, both in college and hopefully what they will then pick up and learn and enhance their skills even further on placement. As a college and as a provider, we hold something called a Careers Extra Forum. And we do that 3 times each academic year, where we invite our local employers that employ our students, and we take placements out, and we invite extra ones that we are looking to try and get students into for placement. We invite them actually into the college, and we go through things with them. So we have, like I said earlier, we have stations where the students can be set up to do, and they'll be demonstrating some of the skills that they're learning. Even things down to, we had bed making and hand washing skills down there, so that the employers see that we are going right back to basics, and we want them to start from the very basic level and build up and gain those extra skills. We then also, as part of that Careers Extra Forum, we get out our specifications, we have a look at the curriculum, all the different specifications with those employers, and say, look, this is what we're doing. Is there anything else we could do differently? We also, through that, and we identified, yes, we were picking up all these amazing skills that the students needed to learn, but how were we actually documenting that they were doing it? So we found that there was a gap in how we were documenting the actual skills and extra skills they were learning, other than the ones they were learning on placement. So we've created a college practical skills guide based on the T-level health specification that we get our students signed off in. They're all split off into their supporting healthcare, they're split off into core and all their different occupational specialisms, and the students have to get those signed off with us while they're in college, while they're learning those practical skills to enhance their skills that they're learning on placement. We also have a placement officer. We've had a bit of a rocky ride with our placement officers. We've had 3 in the last 2 years, but we've now just got a new one, and hopefully we're going to get her to stay with us. We have a placement officer who helps our students with finding their placements. Once they're out on placement, she goes out and visits them 3 times to do their checks and check on them whilst they're out on placement. She also helps them support with writing CVs, helps support them with interview practice skills. We do lots and lots of things around that preparedness for going out into placement and into the work environment. So all of this has helped us grow our relationship with our employers, and especially the Great Western Hospital, because as we know, there is a great shortage of nurses, midwives, all the careers that we need. They can see that that's there. So we're building those relationships with them in the hope that we're going to be helping them with the next generation of their frontline workforce, which is what we do to help grow it. But the biggest thing is getting those employers in to see what the students are actually doing, show them the curriculum and show them all the things that the students are learning and that they're going to develop, and how that is then going to benefit the local need and the local area, fill in those jobs that we know there are the big gaps in. And I think, I can't remember if that's it. I think, is there a next slide, Rebecca? So, and again, like I said, because we've been doing this as a Wave 2 provider, and we've built up how we've got to where we are and built up our relationships, we're more than happy for people to come and visit us, us to come to you if it would be helpful, Teams calls for support. Happy to help and support in any way we can, because we've kind of been there since the beginning, sort of thing, and we've kind of tweaked things as we've been going along to find things that haven't worked and things that do work. That's kind of it, really.
Thank you, Karen. And I'm going to circulate the deck afterwards so everyone will have your email. So thanks for that. Yeah. That offer of support. I've got a question around the way that you're working with employers and general employer understandings about the placement. With your experience delivering this now for a while as a Wave 2 provider, how do you feel employers understand the requirements of the placement now compared to, you know, sort of day one, and what the learners can do while they're on placement?
There is a huge difference from where we were on day one to now. But again, it's down to us having built up those relationships with those employers by having them actually come to us 3 times a year. They get to see us, get to see the regular faces, and then they also get to see the journey that those students are going on and see them from the skills that they're demonstrating at the very beginning to the skills they're demonstrating at the end of that year. And it's that gets us the buy-in from the employers, because they are seeing how it's working. And then it is just going through them what the expectations are, and it is much easier getting them in face to face. Bribery with pastries and coffee and sandwiches work to get those employers to come away from industry for a few hours just to come in and see us. And we kind of negotiate with our boss to make sure we've got some teas and coffees and pastries and things for them. And then we just kind of sit and go through a few bits and pieces and answer any questions they've got, because it does make a difference doing it face to face than it does over the phone.
Fantastic, thanks, Karen. And I'll just give the attendees just a moment just to ask any more questions. But just another one really about just kind of reflecting on where you are now from where you started as well. So in terms of what you know now and the way that placements have evolved, what do you think the one takeaway is in terms of what you wish you'd known on day one?
I think I wish we'd known on day one, get the employers in early, get the employer buy-in, get them actually seeing your facilities and show them the specification and show them all the things that the students are going to be learning, because then they realise that they're the ones that are going to become their future workforce, and they need to help us invest in them to keep them local. Because otherwise, if they don't get those experiences and chances to work here, then they'll go elsewhere. And that's why you end up losing the workforce from local area.
Brilliant. Thanks, Karen. If there's no more questions, we'll move on. Oh, I've just accidentally moved the slide on anyway. We'll move on to speak to Lucy Hunt, who is from NHS England. I'm sure many people have heard Lucy speak at events before. Lucy's always doing a brilliant job of banging the drum for NHS workforce development and the role of T-levels within that. So thanks so much, Karen. And that obviously was the provider aspect and working with the NHS, and now moving on to Lucy in her role with NHS England. So again, Lucy, I'll run the slide, so just let me know when you want me to move forward. So I'll just push on to your starting slide.
Yep, thank you. Delighted to be here. Next slide. I mean, to be honest, Karen really covered it. So, you know, in terms of what a good quality industry placement looks like, they're doing a fantastic job. But I think from the employer perspective, you know, there's still a lot of struggles in the NHS in terms of colleges being able to engage with NHS employers. There's still a lot of myths around under 18s in clinical areas, so I think we really need to work together to kind of bust that. I know Gatsby have got resources, NHS employers have been doing resources, but yeah, I keep getting told, but how are they doing it? You can't have under 18s in clinical areas. And I say, where does it say that? Show me in your risk assessments where it says that. So I think we really need to get that message out. And I think, you know, Karen again gave a great example, but it's that co-design with the employers and systems. If you can engage with your local employers, and now obviously we're working across the 42 ICBs, it's much more system level. So some of them placements could be in social care, not just in the NHS, but I think, you know, to get those employers on board at the beginning is essential. And communicate and plan before enrolment. I think far too often now, myself and also the AOCT level team are getting called in at the last minute from frantic colleges who we've got learners that are due to go out on placement and we haven't got one. So I would really say that, you know, in best practice, you should have those placements sorted out before you enroll the learners. Otherwise, you know, you're really putting yourself in a precarious position, and potentially, you know, the stress of them not knowing if they're going to have a placement is going to really make them disengage. Solid induction, I think again Karen covered all of this, but you know, uniform, DBS, health and safety training, the mandatory training that we have to do in the NHS takes time. So I think you have to have a clear plan and an agreement with your employers and how that's going to all happen. And do utilise us, the AOCT level team. So I work really closely with Stephanie and Peter from AOC and NHSC. You know, if you are really struggling, don't leave it to the last moment, please, but do drop us a line and we'll help to try and make those relationships and encourage you to interact with local employers. We are really looking to do more case studies and sharing best practice, because I think that's going to be a way that we overcome the myths. I'll be following up with Karen in terms of, you know, doing another case study about her learners, because the progression routes, the opportunities, and also I had the pleasure of hearing from the actual students. And I think if these young people are so committed and can make a decision at that age about what they want to do, we really need to be supporting them. The NHS needs them in the workforce. We've got about 120,000 healthcare support worker vacancies, about 40,000 nursing vacancies, and so these, you know, this talent pipeline is the future of our workforce. And I think, you know, again, Karen touched on it, but it's really important with the young people to be able to show them the career pathways and progression opportunities that T-level can get them into. I think, you know, there's so many different roles. Obviously, nursing everyone's familiar with, but we've got the 14 allied health professions, and a lot of young people wouldn't know about the opportunities available to them. So I think, you know, we've got a lot of resources. I've got the link on my next slide, but on our healthcare apprenticeship standards online website, there's a lot of resources. There's a lot of career pathway tools, visual maps. There's quizzes if they don't know what they want to do. Yep, that's it. Thank you. So I would say, you know, sit down and have kind of the conversations with them, and we are looking to kind of share best practice and get potentially an NHS England T-level steering group up and running for 2025, because from what I'm hearing, if it's going well, it's going really, really well, and then we've got a bit of a grey area in the middle, and then we've got where, you know, it has not worked as well as it could have because of various reasons. But I think we are learning a lot of lessons. After a shaky start, I think, you know, the progression and the data and the numbers are growing steadily, and we really need to embrace that. So yeah, this is the website. You'll get the slides. If you click on the link, you can join up, and we have a weekly newsletter. So it'll talk about kind of, you know, hot topics in the NHS, but also be able to have those conversations with your young people and really give them that careers advice and guidance. And that's it from me.
Fab, thanks so much, Lucy. And it worked really well, I think, to have you speaking alongside Karen, just to show that alignment, I think, between providers and employers when it's working really, really effectively. In terms of your kind of employer perspective, where do you think the areas are that are working really well with placements that you've seen at the moment, and where do you think the areas are that you know, have a little bit more room for development? What would work better for you? What would your wish list be?
So I think with AOC colleagues, we're really going to have a regional heat map, because I think even within a region, there can be wildly different variances for the experience of the students or the experience of the colleges. So I think that's where NHSE can really come in and kind of help be a conduit to make sure that they've got those strong relationships. It shouldn't be the case, but at the NCFE event recently in Wigan and Lee College, I had a steady stream of colleges saying, but we've heard some really, really great stuff, but our experience is not like that. So I really want us to kind of step into that role and help make sure that those relationships can be formed, because this is a really integral pipeline for us moving forward, and this is our future workforce, so we need to try and crack the issues. But yeah, and again, I think I mentioned the under 18 myths. That's still a challenge, and there's still myths around mental health, that you can't have them in mental health placements. So again, I think we need to make sure that we've got best practice and resources out there, and just kind of bust those myths once and for all.
Fantastic, thanks, Lucy. And in terms of those different areas and the different areas that T levels cover and where students might want to go on the sort of next stage of their journey or directly into employment, what kind of advice would you give to providers to drum up a bit more interest, as well as the website that you've shared? Is there anything you suggest in terms of ways that providers work with their local NHS trust?
Yeah, I think that partnership collaboration working is really important, that kind of co-design as well. But I think, it's don't assume, ask the employers what their local needs are. I think Karen touched on that. They're going to be looking at therapies because they've got that regional demand. So as much as we are the biggest employer on one NHS, there's 219 different individual trusts across the country, and depending on their regional priorities and workforce, you could be putting on a program that they haven't got the demand for. So I would say that early engagement to making sure that any program that you're developing is actually going to meet their needs, and plus that they will have the capacity to host the industry placements, and that's not going to be a challenge. I think there have been lessons learned along the way, and the programs that I see that are working really well have had that employer engagement from the very start, and they've helped kind of mold that delivery. So yeah, and I think there's been other instances where we have had employers lined up for industry placements, and then the college hasn't got the enrolment numbers that they need, or and so they've closed the program. So I think there's lessons to be learned on both sides, but I do think that kind of early engagement and communication is essential.
Fab, thanks, Lucy. Are there any more questions for Lucy? Okay, brilliant. Thanks so much for that, Lucy. It was really helpful. And as I said, really good, I think, just to see that alignment between what's working really well from the provider side and the employer side. And I think shared expectations and shared appreciation of the programme is clearly one. And the fact that, you're both so clearly aligned there in terms of what you said was, it really spoke to that. So fabulous, thank you. We're going to move over now and speak to Gatsby. So Claire Reynolds is going to present on the resources that Gatsby have available to support employer engagement for industry placements. So Claire, again, just let me know when you want me to move the slides on, and I'll start with the first slide that you sent through to me.
Thanks, Rebecca, for having me. It's really nice to be here. So my name's Claire Reynolds. I'm a therapeutic radiographer, and I currently support the Gatsby Charitable Foundation on the Health T-level work stream. So despite the fact that I work for Gatsby, I don't have a huge amount to do with providers, because my work is mostly about supporting employer engagement for industry placements. Rebecca, if you just move to the next slide, please. So I support an ICS network, which is an employer-focused network, and we currently have, about 150 different NHS and care organisations as part of that, with about 250 members, and we currently have representation from 41 of the 42 ICSs that Lucy spoke about. We're looking at that network as a way to support employers to build industry placement models for their organisation, and we do that by having quarterly meetings, bringing together the whole network. They're very much a kind of a broadcast meeting where we have updates from DFE to support on policy updates and guidance. We like to feature within that case studies of where things are going well, or where there have been challenges that have been overcome. So obviously Lucy mentioned the under 18s, also certain clinical areas. So for example, we've supported on showcasing a midwifery placement model. We also have monthly lunch and learn webinars, and they again take place to build awareness and support the development of industry placement opportunities. Within both of those pieces of work, we also like to bring in education providers who can showcase that collaborative working with their local employer organisations, or highlight parts of the curriculum that are directly translatable into certain careers. So thinking about the healthcare science T level, because that's often the one that's used for a lot of the AHP careers, and certainly my own in radiography. So we really want to use that network as a way of sharing best practice, highlighting the challenges and the barriers, but also how that they can be mitigated and overcome. We're soon going to be developing a share and exchange meeting that will take place in between each of the quarterly meetings. There's a much more free-flowing conversation that employers can have together. If you can move to the next slide, Rebecca, please. So I'm not going to read this out to you, but Simon Bone is one of the Department for Education funded IFCOs in Bristol and North Somerset. And this is just what he has to say about being part of the network, which is really lovely to hear. If you can move to the next slide, Rebecca, please. So these are just some examples of the work that we're doing at Gatsby to support place-based work. In Greater Manchester, we supported a piece of work looking at 5 at-risk allied health professions. That came from workforce data from NHSE, and we used that knowledge to support a college to develop placement opportunities within those 5 professions. We didn't manage to crack all 5 of them because the research took place over a finite period, but we highlighted an engineering student moving into orthotics as part of their placement opportunity, and she's now decided to move from wanting an aerospace engineering career to looking at a degree apprenticeship in prosthetics and orthotics moving forward. So the next slide, Rebecca, please. And again, this is another place-based piece of work looking at innovative models across the system. So Lucy mentioned about the ICS, and that has health and care within that, local authorities, and we're trying to showcase that the diverse range of opportunities that are available to showcase careers that students could move into, but as well looking at how the system can come together to support the upscaling of placements. So that looking at those opportunities outside the acute trust, where providers and employers are using that 2-employer model to support placements and support all those learning objectives for the students. The plan will be to disseminate that through blogs and articles, videos, webinars, and we've got our colleagues in the technical education networks at Gatsby who will also be showcasing them so that students and providers can see those models working in practice as well. Next slide, please, Rebecca. We're supporting NHS employers on their upscaling T-level placements in healthcare programme, and they're bringing together a hub for employers to be able to see guides, blogs, articles, webinars, toolkits that they can use, a bit like Karen was talking about earlier, so that those resources are there. It's not kind of starting from the beginning, but they can see those examples working in practice, and use that information then to move on with their own industry placement journey. Next slide, please. So we also took T-levels and the ICS Industry Placement Network to NHS Confed, the expo in Manchester this year. I almost said last year. It was in June, And we had 2 days at Manchester Central. The conference itself has 5,500 delegates, and there's a real mix of operational staff using it as a CPD opportunity, as well as senior leaders and strategic people from within NHS organisations, but also at system level. And we spoke to everybody we could, highlighting T-levels, showcasing the resources that we have, showcasing case studies. And we had different employers who are really doing great work from across the country to speak to delegates about T-levels. We also hosted a breakfast session where we set a bit more on the context. So we really are trying to educate employers as well, so that they're aware, so that when providers do come to them asking about placements, that knowledge is there as well. Next slide, please. I think that might be it.
That's everything. Thanks,
Lovely.
Claire.
Thank you.
Thank you so much for that. Really useful. I'll just get started with a question, and please do get your questions in if you have any more. In terms of your engagement with employers, then Claire, what do you think the kind of key concerns and challenges have been around T-level placements, and how might providers mitigate those in terms of the work that they do to try and bring employers on board?
So I think a lot of it is around, I guess, the translation of the specification into a guide. Karen spoke earlier about that sort of student checklist that she has, that they sign off the skills that they have, that they're developing at college, so the employer can see that. I'm doing a piece of work looking at kind of a quality framework that echoes a lot of that work that Karen talked about, where we have a checklist that students will be able to sort of work their way through on placement, so that exists for employers. It's not a competency framework, but it is just, we're very used to in the NHS working with competencies in that sort of see one, do one methodology. And I think that a lot of it is around that, and that, you know, the specification is a really big piece of work, and employers to sort of drill down into what they can do where. I think that's the real thing, is that what can these students do, because we obviously advocate that they can be part of a team and they can work with your current staff to sort of support patients. So I think that's a really important thing to get right.
Fantastic, thank you. And in terms of the one thing that you think would be the most useful way for providers to engage with employers, what do you think the kind of the hook would be to get those employers on board, if they were going to if a provider was trying to make a case for a new employer to come on stream locally, whether that's NHS or potentially even, you know, someone in the care sector?
Absolutely. I mean, I think it is about looking for those opportunities, you know, across health and care. I think in terms of, you know, selling the T-level students, I guess it's that twofold benefit, that there is the benefit to the student and in the immediate and the work, and that they are the workforce pipeline. I think it's also important to bring into that case is the benefit to staff, that, you know, recruitment and retention are two key parts of the long-term workforce plan, and retention of our current staff is an imperative, you know, because these students are not going to be entering into the workforce immediately. But those benefits that they bring to, for example, the clinical support workforce, where they are given that leadership and mentoring opportunity, to mentor these students, to support them while they're on industry placements, I think is a really good way of rounding out their career potential, even if, you know, it gives them evidence to move if they want to on that career pathway, but it also is a fulfilling thing as part of their current role. So I think it's a really good hook, I think, for employers.
Fab. Thanks so much, Claire. That's brilliant. And
Thank you.
We're going to go on to our final speaker of the day. So we have Kerry-Ann Pilato from ETF, so the Education and Training Foundation, who's going to share with us some of the professional development offer that ETF have. So again, over to you, Kerry. I'm going to be your clicker, so let me know when to move. I'll just start with your first slide.
Thank you. Yeah, I think probably we work together very closely with the AOC, with the SDN network. You know, we're all here to support. We have various different sort of areas of support. We're predominantly looking after the teaching staff, the providers. We are there to provide training and support. Our expertise doesn't specifically lie in industry. You know, we have the SDN network. There's lots of work going on with employer engagement directly. But what we do have on offer are ways into employers to be able to start those conversations. And as we've said, those conversations are really critical to start talking to the workforce. What is it that you need? How can we bring that back into the classroom? And, you know, in developing those relationships, then you can start looking at developing your curriculum, you know, getting ready for those placements, understanding what the learners need to go into those placements. So we have a series of industry insights. There's 4 elements of that, 2 of which come with remission funding. So if providers want to go out into the workplace and spend time with employers, there's a £400 per person per day remission funding for that. And lots of, I know Truro's on the call today, Truro, Cornwall College, but lots of colleges have really made use of this on their Back to Industry Day and being able to benefit from that financially. So, you know, whether you want to go on individual placement, or we also provide employer-led group placements, which also come with remission funding, so you can log on to those live online. They're 2 to 3 hours and they come with remission as well. We also have abundance of workshops, recorded archive workshops from employers, which can be used in lessons, and it's just keeping on top of what's happening in the industry, particularly in health at the moment, you know, and being able to have that access to employers. Yes, and obviously we've got links to the dashboard as well. So if you want to learn more about those and what's coming up, we have lots of very interesting health-related placement industry insights that you can log on to. Next slide, please, Rebecca. So we have some dates here of the workshops coming up, so I won't go through that, but that's all the links to log on to those dates, and you can see sort of what workshops we've got coming up. And there's access there to some of the previous recordings that we've had, which are really, really helpful and really useful. Yes, next slide, please. I wanted to talk about also the networks and conferences coming up, and this is an opportunity to get together with other providers like Swindon, you know, that are doing some really good work, really good practice, and to be able to talk through some of your challenges, get together, buddy up. You know, we often have guest speakers coming on and talking about, you know, what's happening currently. There's some dates there. Again, just click on, once you're on our platform, you're free to book onto any of these networks, and obviously hopefully that will give you an opportunity to find out what's happening, not just locally but across the country as well. There are curriculum specific, health specific networks coming up, so I'll make sure that you have the dates for those. They're coming up sort of next year. And we've got a face-to-face conference coming up as well, which is always a really good opportunity to meet other providers and listen to guest speakers. So that, again, is another opportunity for you to find out a little bit more about what other people are doing and how that's working in specific areas. Next slide, please, Rebecca. The TRIPS project. So we work very closely with the AOC to produce these T-level resource improvement projects. And these are real takeaways. What's been created here, and specifically in healthcare science, health and general sort of holistic industry placement related resources, are a pick and mix of providers coming together and producing resources that fundamentally will help delivery. And some examples of those are developing employment competency. So there's a whole package, you can download resources there, holistic planning and delivery. We've got partnerships to develop effective health and nursing T-level placements. We've got a passport to placement toolkit for the health T-level. So there's a huge amount there. So if you I'll put the link in the chat actually, so you can go in and have a look at some of those resources. They've been produced by providers over the last couple of years. We've just got a brand new cohort of providers about to develop another range of resources, so they'll be available sometime next year. So watch this space. These are constantly updated with new resources. and you know, some of them are really high quality, so that they're worth a look. If you want to produce a trip project yourself, then that's something that you can talk to your relationship and development lead. There will be one for your provider. If you're delivering T-levels, there'll be somebody like me that will be able to talk you through, show you everything else that we do, all the route specific training. There's a whole, you know, whole package of support there. So yes, come to your relationship and development lead if you want any more information. Next slide, please, Rebecca. I know we're running short on time. There's a case study here. You'll have access to these, and you can read through. There's plenty of case studies on our website as well for you to have a look at. I mean, it's really important. I've been involved just recently in the NHS Devon, One Devon programme, where we're trying to standardise the industry placement framework. You know, the documentation that comes with that, the sort of strategies for developing, you know, what can students do, what can't they do, you know, how does it work? And hopefully by next year we will have some, you know, there's work going around, but specifically in Devon and Cornwall, these areas have had some challenges, you know, sort of linking up with their trusts. So there'll hopefully be a package on offer by March next year to sort of mitigate some of those challenges and put together a bit of a standardized format for the industry placements. And again, it's been mentioned, the allied health professionals, you know, I've spoken to podiatrists, radiographers, they've already started producing resources that link with the core directly to get those students straight in and up and running to work with the, you know, the support staff. So, and we're also looking at mentoring as well. There has been barriers around mentoring. How do we as employers, you know, what do we do with our students? What can they do? So hopefully there'll be some more information around that as well. Next slide, please, Rebecca. And I've just put together some links and information here, which will actually link through to some of the colleagues online today. So that's it from me, really. If there's any questions, then please, I'll put my email in the chat if you want to know anything more about the Education Training Foundation. We have, you know, a fair few resources to rummage through. So that's it from me. Thank you.
Thank you, Kerry. That was really useful. And I know I keep saying this, but as a reminder, everybody, I am going to share the slide deck separately. If you're watching the video on playback, please just get in touch with NCFE if you don't have a copy of the slide deck, and we'll be happy to share it. In terms of questions, I wondered if I could just ask you, Kerry, with all your experience of working with providers and employers on the T-level, what your top tip would be in terms of what makes a really effective placement. So obviously you've done all that work in Devon in particular around engagement with employers.
Yeah, it's crucial to get those conversations in early, and if you've and be creative. You know, there's lots of care homes out there that can offer sort of initial placements, soft placements. You know, there's help everywhere, and it's being able to sort of show the benefits. And I mean, it's been said before, it's getting the, you know, the work, looking at the workforce, listening to the employers, you know, finding out what's needed specifically in your area, because there'll be gaps. You know, look at your sort of your LSIPs and your labour market information. You know, it's important to have an overview of what's happening and to have a really good package, you know, promotion and marketing, you know, speak to parents, you know, who's involved with what, you know, just approach employers, offer those breakfasts, offer those, you know, there's a lot of work, and I mean, it is quite time consuming. So, you know, appreciate that, you know, any support that we can offer to make that, you know, less of an onerous task, you know, use it. And as I said, we all work together to support. So, you know, the need is out there. It's just finding those routes in. Go on LinkedIn. You know, you've just got to be a little bit creative about how you approach employers. But yeah, it's important to get those conversations in early.
Fabulous, thank you. And I think we've just got a couple of minutes left now. I know everyone's very busy and is either probably trying to get off from leaving work, or it's just arrived home, or dashing between different sessions. So by way of a wrap up, if we just share any final questions. And I don't know whether our speakers have any final thoughts or reflections after hearing from colleagues from different angles on placements. Just give everyone a minute just to reflect on that.
I would just say I think there's really shows how much the support there is out there, and that, you know, colleges and employers have access to great resources. So that's quite heartening, actually. And hopefully, yep, we'll just continue to have bigger numbers in 2025.
Thanks, Lucy. Claire, do you want to come in?
Excuse me. Yeah, I agree with Lucy, but I just also wanted to make the point of not to allow the occupational specialism to put a barrier in place for different areas of health and care in terms of where students can go on placement. You know, that was part of the work we did with GM, was to highlight that adult nursing occupational specialism students could do their placement, have placements in AHP careers, to showcase that those careers existed as well, and that they were able to fulfill their learning outcomes that way. So I think that's, you know, just a little bit of a takeaway, that there's so much opportunity out there. Yeah, thanks.
Thank you. Anything from you, Kerry or Karen?
I think for us, it's just getting those conversations in early with those employers and showcasing and showing them and getting them to see the curriculum and the expectations. And it is identifying those gaps. And it was like you were just saying, that it is just because they're on one specific pathway, they're not restricted to where they need to go. We had last year one student who wanted to be a paramedic. And he said that, well, I know you don't get much midwifery training on the paramedic pathway, so I'm going to do the midwifery pathway and still go off and apply to be a paramedic, which he's done. So it's, don't be restricted, think outside the box. Because we've even got students attached to some of our GP surgeries, working with paramedics, working with the mental health support charities, mental health sessions within the GP clinics. Some of ours that weren't successful in getting their maternity placement, they've gone to the GP clinics and they're in with midwives there. They're seeing minor surgeries in the clinics. Be creative, get them anywhere.
Oh, that's brilliant to hear. Fantastic. Any final thoughts from you, Kerry? So to put you on the spot, just so we got the full set.
No, I'm just totally echo, you know, what everyone has been saying. It's just important to get that support, and don't be afraid. Join the networks, talk to everybody, you know, buddy up with your local providers. You know, I know there's some, you know, not everybody, if you're too close and you're fighting for the same spaces, and I know that can be a barrier sometimes, but you know, there are so many opportunities out there, and it's good to work together with other providers, because it might be that they've got not enough students and they've got employers crying out, and vice versa up the road. So, you know, talk to other providers and see what's happening on the ground. But yeah, just brilliant that there's so much there to be taken.
Well, it just stands for me to say then, with 2 minutes to go, thank you so much to all of our brilliant speakers today. It's really wonderful to hear about all the support that's out there and all those brilliant practices that are in place in providers, in employers, and everything that's going on to make the T-levels such a success. For everyone watching today, I'm going to be sending through an email with the slides and a YouTube link probably in the next day or so. So please look out for that. And obviously, there's been the offer of support and email addresses in the chat box and in the slides as well. So please do reach out to our speakers. Thanks so much for your time today, and all the best with your T-level placements.